you just sent out a statement here. Maybe just tell us a little bit about what your statement says there.
You bet, Jim. So the context is that we have seen this loss of confidence in interior health. We've seen an increasing number of doctors speaking out. We've seen the public expressing their frustration, and we have not seen decisive action to start turning this organization around. For the last several days, the Minister of Health has been unwilling to even state that she has confidence in the current leadership of Interior Health, and that silence speaks very loudly. So this morning, I wrote to the Minister of Health, Josie Osborne, and put out a public statement calling for Interior Health CEO Susan Brown to resign and to make way for new leadership who can rebuild confidence among the team at Interior Health, reopen communications with doctors and other frontline professionals who clearly have felt unheard, and rebuild public confidence in the system.
Yeah, because I mean, me and Ian have talked about this story quite a bit, and Kelowna Now has done quite a few pieces on this as well. And we have a bunch of pediatricians here that are still in the Okanagan here, and yet won't work at the hospital there. Isn't one of the things to do is figure out a way to get them back into the hospital working, to open up our pediatric ward?
Yeah, that's bang on, Jim. There's 20 pediatricians, to my knowledge, who are in Kelowna but won't work in the system. What really worries me is that it's clear there is a retention problem. It's clear there has been a major burnout problem. And whenever we talk about this, the Minister of Health and the leadership of Interior Health keep talking about recruiting American doctors or otherwise bringing people in. But effectively, that sounds to me like bringing in fresh meat for the meat grinder. We need to fix the system, make sure we're not continually burning people out and losing them. And when we have people right here in town who have worked in the hospital and would do so again under better working conditions with better leadership, that tells me there's a real problem here and there's a real failure to understand that you cannot turn a system around without the people in it.
Have you had a chance to speak to any of the pediatricians that are not working in the hospital right now?
Yes, I have, Jim. I've met with pediatricians, I've met with OBGYNs, I've met with emerge doctors. I've heard from lots of people who have worked in the system or who do work in the system. And what I have heard over and over and over again is, again, a frustration at a broken culture, a breakdown in communication, and seemingly an unwillingness to understand that leading the organization means leading the people. I don't see that tone changing, and I don't believe that you can execute a turnaround on your way out the door. So I do think we need to make a change right now to address the crisis that is burning right here and right now.
Have they shared with you any path forward? If they've seen certain things, if they could see certain things change, would they consider coming back to KGH and helping reopen the pediatric ward?
Look, Jim, brass tacks across all of the people that I've spoken with, and there have been many who are in the system or have been in the system. It is clear to me that the biggest change that needs to happen is a change in leadership, a change in tone, a change in human relationships from the top of the system to the people working in it. There are many incremental and substantial operational changes that obviously need to be made. One of the primary sources of frustration for a lot of these folks is that they have put forward good ideas only to feel totally unheard for years. So to me, that signals that a successful turnaround will only happen if you reset that relationship. And that cannot happen with a lame duck leader who's seemingly trying to preserve reputation on the way out the door versus having the hard conversations necessary to reset the system.
Yeah, she is retiring in 6 months. That's been put out already. But is the Premier, Eby, and the Health Minister, Josie Osborne, taking this serious enough? Are they putting pressure on Interior Health to make some changes here?
I think it speaks volumes that the Minister of Health has for several days been being asked by media whether she has confidence in the current leadership of Interior Health, and she has been conspicuously silent. That's not leadership. If you have confidence in your people, then say it. And tell the people in the system that you believe the current CEO, the current board are on the right track, and that that's who they're working with for the next 6 months until there's a change. If you don't have confidence, then pull the trigger and let's get this thing done. We can't afford to spend 6 months flapping in the wind, waiting in uncertainty, and frankly, not getting that reset done so that they can rebuild those relationships, rebuild that trust, and get the system back on track with the participation of the many people who work in the system, who want to keep working in the system, who want to come back to working in the system, who want to see it be successful, and who want to make sure that people and families in the interior health catchment area can rely on their publicly funded healthcare system.
Do you think a change in leadership is enough, like the CEO of Interior Health, or do you think it's many of the bureaucrats that are in there that are just underneath that report to the CEO? Do you think there needs to be change there as well?
Jim, it would shock you how little access and visibility I actually have into the system as the MLA who represents the area. Yesterday was the first meeting I've ever had with Interior Health after asking for a briefing since August. So I can't necessarily speak to all of the details of what is happening there, but I do think that that bunker mentality is a testament to a culture that needs to be fixed. And that starts at the top. It starts at the top both substantively in that that tone is set from the top on down, but it's also symbolic change matters. I do think that when people who are working in the system are frustrated by the system, when the public who have lost confidence in the system see that there is change at the top, that hopefully permeates through the organization, allows for a reset, allows for a reopening of conversations that have been stalled for years, and begins to get the organization back on track. But there's certainly a heck of a lot more that's going to need to be done in order to get this operation fully functional.
Anything from you, Ian?
I would ask, do you have anyone in mind as a successor? Because there is, I mean, this system produces obviously a certain kind of person. Is it not possible that she could go, maybe at great expense? You know, she's paid a lot of money. It might cost a lot of money to fire her. And then she's replaced by somebody, you know, her protege or somebody very similar to her.
Yeah, thanks, Ian. I obviously can't speak to the CEO's contract. I mean, frankly, if I were giving her advice, my advice would be that this might be a great opportunity to move forward retirement by a few months and to signal that she's come to the understanding that without a change in leadership, the organization cannot begin to turn around. I think that would be a very dignified and appropriate way to make an exit. And I think that people would certainly be very respectful of taking that step. As to who should be the new CEO, I think you raise a really important point, Ian. We need to make sure we aren't just replicating the same thinking that has gotten us to where we are today. This is a really important role. We need to make sure we find a really great, solid, new CEO who, most importantly, above all else, is going to have the interpersonal leadership skills to be able to rebuild confidence with the many people working in the system who appear to have lost confidence in the current leadership. So, again, above all else, my sense is this needs to be a people leader.
Yeah,
I would just say as well, maybe for balance, I would say we did speak to her recently, and she actually raised a lot of the issues that you've raised. She speaks quite well and at length about these problems. She's obviously been around a long time. She was a nurse, I believe, so she understands the system inside out. I mean, that would perhaps suggest, wouldn't it, that maybe it's more of a system problem than an individual problem if you were looking at that from the
Yeah,
outside.
Ian, I'm not trying to hang every issue in interior health on the CEO. That's not what I believe, and my intention is not to impugn the character or the experience or the efforts of Susan Brown on her way out the door. This simply comes down to the reality that from every conversation that I have had with people working in the system or previously working in the system, it's clear there needs to be a leadership level reset to reopen those conversations and rebuild that trust. That doesn't mean that everything is that all blame lands at the foot of one individual. Far from it. What it does mean, though, is I don't believe we can wait 6 or 9 months to begin those reset conversations. In any organization, anyone who's ever done organizational turnaround would tell you you can't turn around an organization on your way out the door. You simply cannot. There is a tremendous opportunity with new leadership to have reset conversations that rebuild relationships, that reopen communication, that reestablish trust, and allow doctors and nurses and others who are frustrated, in some cases, who have told me that they've been advancing the same issues and the same potential solutions for 7 years. It allows them to feel as if they will now be heard. That's really just about good organizational management and the reality that clearly there is a broken culture and a broken trust and a lack of confidence within this organization that needs to be afforded an opportunity for a reset.
We are going to reach out to Susan Brown and see if she'll come on as well. So we do thank you, Gavin, for your time. We do have one more question for you on a different topic, if we can just borrow just a quick comment from you on this, because we're doing the story. We see that Tara Armstrong here locally and has joined a new party. They started a new party called 1BC. Any comments on that?
Jim, what I would say is that I'm focused on the issues that I'm hearing about from people in my riding in Kelowna and in the Okanagan more broadly. 80% of the email traffic coming through my inbox is dedicated to the issue of our failing healthcare system, and I have been pretty darn focused on that. And 0% of the email coming into my inbox has been focused on what I believe ultimately is a distraction from our efforts to hold this government to account and to build a government in waiting that can replace the NDP and help this province to get back on track.
Fair enough. I just had to ask. That's what our news director wanted. So I do thank you for your time, Gavin. So again, always accommodating, and we do appreciate your voice in the community. Thank you, Gavin, and we hope you have a great rest of the day and the weekend coming up as well.
Thanks, Jim, and sorry about the technical difficulties earlier.